Okay, see a lot of people coming in. We'll just start in 1 minute. All right, I think we're getting there. See almost 40 people, so I know there are more coming, but we're going to go ahead and get started. We've got lots of exciting presentations, so let me just kick this off and say good afternoon to you all, and welcome to our special Global Health Tuesday webinar. And we have our second cohort of the Planetary Health Graduate Scholars that are going to be presenting, doing their flash talks. I'm Jonathan Patz, Director of the Global Health Institute and of the Planetary Health Graduate Scholars Program. The Global Health Tuesday seminar series hosts researchers and practitioners from around the University of Wisconsin, Madison, and across the world. Speakers showcase the complexity of global health challenges and the many kinds of expertise needed to address them. And this week, we're celebrating, and you'll also hear from our Planetary Health Graduate Scholars. And the timing couldn't be better because, last week was Earth Week, and this week happens to be Planetary Health Week at the University of Wisconsin in Madison. Last night, we heard final project descriptions from over a dozen K through 12 science and social studies teachers from across Wisconsin. If I can, Monet, if you could go to the next slide. These teachers were with us for a year-long engagement, learning planetary health. And a year ago, some of our graduate scholars actually kicked off the first workshop for this partnership with the UW School of Education. The School of Ed's Professional Learning and Community Education, or PLACE, is the group that helped us coordinate this first ever K through 12 teachers planetary health workshop. So that just happened last night. And these graduate scholars that you're going to hear from later really helped us kick it off. There are lots of projects around entomophagy and some other ones that you'll hear about. Next slide, Monet. This week also happens to coincide, I'm sorry, that's one of our teachers' presentations from last night. This week also coincides with the International Conference of the Planetary Health Alliance. This year, the meeting is based in Brazil, but of course it's a virtual meeting. This morning, several of us that have been working on a report of the core elements for teaching planetary health across disciplines released this report, and this was at the Planetary Health Alliance conference. UW-Madison is a member of the Planetary Health Alliance. And as you can see in this diagram, the interconnections with nature, the Anthropocene and big planetary disruptions that have health impacts are part of this. Systems-based thinking, equity is a core component, and also movement building. So these are core elements. And we sent this document to all of these planetary health scholars a couple days ago. So they are up on this, and you're going to hear some of their projects that relate to some of these core components of planetary health. Planetary health recognizes that the health of the planet and our own health are very interconnected, and explores political, economic, and social systems that govern those effects. It calls for us to explore the links and challenges us to find solutions for health across species and across generations. So that's a big equity component. At the end of of our Planetary Health Initiative, it's important to recognize that our initiative is a joint program that combines expertise from across health and the environment. So it's a joint program facilitated by the Global Health Institute in partnership with the Nelson Institute for Environmental Studies. So without much further ado, I want to welcome you to the 2020-2021 cohort of Planetary Health Graduate Scholars. These students and their faculty mentors have spent the last year working on projects that show, again, how much we need to work together for a healthier future in a far more integrated way and transdisciplinary way than we're used to doing. These amazing students come from across campus, representing engineering, education, letters and science, agriculture and life sciences, nursing, and the Nelson Institute. Together, they're finding solutions that benefit health for all. They're developing a greater understanding of the interconnectedness of their research across disciplines. And I want to take a quick, important moment to recognize Dave and Sarah Epstein, who are UW alumni and members of the Global Health Institute Board of Visitors. And they generously helped spark UW's effort in planetary health. This is one of the first graduate scholar programs in the nation, and we thank Dave and Sarah Epstein for their generous support for getting this going. Their innovative thinking and incredible leadership continues to advance this scholarship program and beyond. And at the end of the webinar, after all these flash talks, stay tuned because we're going to have two exciting announcements about the continued expansion of this incredible multidisciplinary support that Dave and Sarah are helping us do. So the way tonight will work, a little housekeeping, is you'll see the video presentations from each scholar. Then the scholars will be available for live Q&A for 2 minutes. So if you have questions, please put them in the chat. And at the end of the evening, we also expect to have a little bit more time for some of your questions that may be remaining. And then we'll give you two exciting planetary health announcements at the end. So here we go. First up is Jessica Leclaire. She's a doctoral student in the School of Nursing, and her faculty mentor is Susan Zahner in the School of Nursing. So Jessica, now the exciting presentations, now that my introduction is over, on to the scholars.
Hi, everyone. My name is Jessica Leclaire. My pronouns are she, her, hers, and I'm happy to share about my research on critical environmental justice nursing for planetary health. My background is public health nursing, and after witnessing the health effects of climate change in Madison, Wisconsin for over a decade, I felt that there were very few resources at the time for public health nurses to effectively make a difference. So in 2018, I joined academia to educate the future nursing workforce about planetary health issues, including climate change, and how nurses can address these public health threats. Because planetary health is an emerging field, I've also committed myself to conducting research on effective environmental justice nursing strategies that promote planetary health. I'm completing my second year in the PhD nursing program, and my goal is for our nursing workforce to feel empowered and confident in their ability to address these often very complex issues. Environmental justice is a planetary health topic that presents a vast and urgent opportunity for expansion in nursing research, education, advocacy, and practice. Our recent scoping review of the literature on environmental justice nursing strategies found that nurse authors suggest multiple local and global nursing opportunities to promote environmental justice. However, there is a concerning dearth of research that documents or observes strategies used by nurses who already engage with diverse communities to address the intersectionality of environmental oppression that exists. 24 articles in our final sample described research projects, most of which utilize community-based participatory research or participatory action research methods. Articles in the sample highlighted the importance of authentic community partnership and addressed a range of environmental exposures and subsequent health and racial inequities. Climate justice, a concept that emerged from the environmental justice movement and intersects with planetary health, is a recent focus in professional nursing. The findings of our scoping review highlighted the need to better understand the role of nurses in the planetary health movement. I explored this in a paper with Dr. Teddy Potter. In our paper, Nursing on the Journey Towards Planetary Health, we introduced nurses to planetary health and new directions for nursing research, education, advocacy, and practice. We also discussed how the emerging field of planetary health describes the great acceleration of humanity's disruption of Earth's natural systems due to the domination of others through forces such as colonization, racism, and anthropocentrism. This journey towards planetary health will require transformation of all of our systems for a sustainable and livable future. Upon exploring the role of nurses on the journey towards addressing the root causes of planetary health problems, it became clear to me that I would need a strong conceptual framework that describes these processes to help clarify and guide my own research. This past semester, I conducted an independent study at the School of Nursing with Dr. Linda Oakley and Dr. Janelle Lukey, where we created the Critical Environmental Justice Nursing for Planetary Health Framework. The purpose of our framework is to help guide this work of making today's opportunities for personal and planetary environmental justice cornerstones of innovation in nursing education, science, and practice. Our framework applies critical theory to the way we conceptualize and understand the root causes of environmental injustices and transformative strategies to end the violence of supremacy and capitalism. Our framework builds on the relational core of the nursing profession by calling for ethical responses to injustices and to beliefs that non-males, non-whites, and non-humans are lesser beings until made profitable. This response will require nurse leaders to be well prepared in the science and practice of planetary health and the ontologies and epistemologies of regeneration and transformation. My dissertation study, to be formally proposed in spring 2022, will utilize the Critical Environmental Justice Nursing for Planetary Health frame as a guide for a critical grounded theory study to be initiated, hopefully, in summer 2022. The goal of this study is to generate a mid-range theory that describes how community-based nurses engage in environmental justice practice that promotes planetary health. Here are my references. Thanks so much and take good care.
Thank you, Jessica. Let me just ask you one quick question. You know, we are faced with climate change as a global climate crisis, really, and as a health crisis. Can you talk a little bit more about some of the ethical issues that climate change poses to communities of color and impoverished areas?
Sure. Yeah, thanks for asking. So as I said in my presentation, my background is public health nursing. And so, you know, as I said, I witnessed the health effects of climate change playing out in low-income communities of color in Madison. And what I was seeing is the intersection of poor quality housing and really just housing infrastructure that's literally sinking into the ground as we're having repeat flooding. And this affected young children in the community. And it was first noticed by elementary school principal that was noticing that kids from these neighborhoods are coming to school increasingly sick with respiratory illness. And so what I discovered was there's just a lot of bureaucracy, frankly, and infrastructural barriers to highlighting health and health inequities and the relationship between that and ongoing flooding concerns. And it pointed me to the importance of centering community expertise and knowledge in terms of how to design strategies that address these. What many of us wanted to do that worked in government wanted to fix the problem right away. And families said, please don't call building inspection and please don't, you know, do that because we have an affordable housing crisis in Madison, and we would rather right now stay in these unhealthy buildings than sleep in our cars because eviction is a reality right now. And so it just highlighted for me the importance of, again, centering people that are most affected by our climate crisis in climate solutions.
Wow. Well, thank you. Thank you. It's a challenge. Well, let's move on because we are, I think, already 4 minutes behind. So Jules Reynolds, who is in Environment and Resources in the Nelson Institute and also in CALS. Her advisor is Michael Bell. Jules, speaking of local COVID issues and food.
Hi all, my name is Jules and I'm pursuing a joint PhD in the Department of Geography and the Nelson Institute for Environmental Studies. My research is supported by the Center for Integrated Agricultural Systems at the University of Wisconsin and Brick Cider, and of course the Planetary Health Scholarship Program. So everyone in this room, this virtual room, experienced firsthand the shocks that reverberated through our food system as a result of the COVID-19 pandemic. National food supply chains broke down when restaurants and schools closed their doors, leaving Wisconsin dairy farmers to dump thousands of gallons of unpurchased milk. Meat prices skyrocketed when COVID-19 outbreaks and meat processing plants disrupted supply, leading consumers to place unforeseen burden on local meat producers. Grocery store shelves ran empty. Last summer, we watched in real time as COVID-19 exposed in stark and unignorable ways the fragility of our food system, the food system we rely on for survival and our health. And when I say food system here, I am referring to the processes and people from start to finish, production to consumption, that move our food around our communities and the world. Last summer, in real time, we were also forced to adapt to these shocks to our system. I work with Brick Cider, a farm-to-table cidery and restaurant in Mount Horeb, a community about 20 miles west of Madison. In spring 2020, Brick's closed its restaurant and instead became a local grocery service for community members of Dane County. This response to the COVID-19 crisis enabled local farmers to continue selling their food products to a local market while providing a safe way for consumers to purchase food. Ultimately, this strengthened producer-consumer connections. In short, this was a project of resilience. My dissertation research focuses on this project of resilience, which we are now calling the local community food hub model. Now that Bricks has slowly reopened as a restaurant, and as we all look ahead toward a post-quarantine, if not entirely post-pandemic life, we are envisioning ways to continue building resilience in South Central Wisconsin's local food system. We envision a resilient food system as one with shorter connections between farmers and community members. A resilient food system is one that revolves around community, from production to consumption. So this local community food hub model helps to build those aspects through education and outreach events, as well as public sector collaboration. My research asks how this version of resilience can be actualized through the local community food hub model, and how this resilience can engender justice in our food system. So this work is supported through a 3-year USDA Local Food Promotion Program grant, which we received last fall. So this research project is really just getting started. It is community engaged, meaning that the research questions and design are really shaped by Bricks and the grant project members I work with. For the next few years, I will be coordinating a variety of community-based events and educational outreach opportunities to invite more community members into this local food system. These may include developing internet-based tools, in-person events, and community conversations around local food. The idea here is to continue to strengthen the connections between producers and consumers through these events, and to figure out, for farmers and community members alike, what works in bringing people together. I will also conduct interviews with farmers and community members to gather more information on ideas of and needs around resilience, and implement project evaluation around the USDA grant. Ultimately, I hope to learn whether the kinds of resilience we build into our food system in response to the COVID-19 pandemic will also enable resilience to other kinds of shocks, such as climate-induced changes. When we talk about resilience to climate change, many people think about the resilience of ecosystems, which, as Planetary Health reminds us, is entirely connected. So I'm curious whether building community resilience in our food system also supports ecological resilience on our farms, and how we might build those kinds of resilience together. As we learned last summer, and I'm sure we'll continue to see in the coming years, we need all kinds of interventions around resilience to weather these kinds of changes in our food system and our lives. And really, it's because of the work that our farmers, other food producers, and community-engaged partners like BRICS are already doing that I'm hopeful that we'll only continue to see increasing resilience for the health of our communities. Thank you.
Great. Jules, thanks so much. So let me ask you, how do you hope your research will impact or change current farming landscapes?
Yeah, absolutely. Thanks, Jonathan. So clearly we're hoping that by investing in this local community food hub model, we're hoping that more community members will invest in local farms and local agricultural businesses and food businesses. And the idea is that, you know, if farmers have more community investment, more community support, they can make more, you know, on-farm changes or just better farming management changes, potentially, you know, agroecological decision making that would support like climate change mitigation, for example. So just really hoping to kind of support local farmers who are already doing this amazing work by investing more into the South Central Wisconsin food system. And a big part of this grant project is also to try to disseminate this research and this project as far and wide as we can. So, you know, going to conferences and writing papers and a lot of public facing, you know, media posts. And so hopefully, ideally, more local businesses or, you know, local communities will be inspired to adapt the local community food hub model to their own community and own food system. And the idea would be that it would, you know, spread across the country. Who knows if that'll happen, but that would be the hope.
Great. Jules, thanks so much. So speaking of the food system and ways that we need to be thinking creatively and thinking about innovative farming practices, our next scholar is Martin Ventura, whose graduate advisor is Susan Paskowitz in the Department of Entomology. Martin, tell us what the future of food looks like.
Oh, it may include insects.
Yeah, so let's see your video.
Now you all have it queued up, correct?
Yeah, here we go. Here we go.
Hi there, I'm Martin Ventura. I'm a second-year master's student advised by Dr. Susan Paskowitz and the Entomology Department here at UW-Madison. It's my sincere honor to present this flash talk about my work and this my second year of participation within the Planetary Health Scholars cohort. Well, the central theme of this short talk is on my research in the field of insect agriculture. I think I'd be remiss if I didn't acknowledge the great experience I had serving as the graduate teaching assistant for the inaugural semester of UW's first ever undergraduate planetary health course, aptly titled Our Planet, Our Health. Amidst the intensity of the COVID-19 pandemic all around us and the strangeness of remote learning, assisting with this class really deepened my academic grounding in the planetary health framework and offered me some expanded insights into the relevance of my own research in entomology toward the health of humans and non-human planetary denizens. So in the spring of 2021, the emphasis of my work returned solely to research, and after many months of preparation, all of our preparation happily came to fruition when we were able to experimentally test the growth and nutritional impacts of cricket feeds derived from maize stover that's been fermented by pleurotus or oyster mushroom. I'd like to offer a little context about edible bugs and why we think they're important to conversations about planetary health. Farmed insects are nutrient-dense food for humans and livestock, and many people, myself included, hope that insects will serve an ever more important role in meeting increasing global food demands while contributing relatively less to agricultural infringement upon planetary boundaries. This optimism seems somewhat well-founded. Many insects, including the subject of our study, the two-spotted field cricket, known as Gryllus bimaculatus, seen here nibbling a leaf I gave them as a treat, produce fewer greenhouse emissions, require less water, less land, and less feed per equivalent weight than most commonly farmed vertebrate livestock like cattle and pigs. So the feed we give to farmed insects like these crickets is really the core question of my study. The cultivation of corn or maize dominates many agroecosystems worldwide, including in rural Zambia, where our research project subsidizes 4 small-scale cricket farms. Unfortunately, it turns out that corn grain alone makes kind of unimpressive cricket chow. In rough strokes, it's got too much carbohydrate and not enough other nutrients to sustain healthy cricket populations. My research poses this question. What kinds of inexpensive and abundant stuff does it actually make sense to feed to farmed insects in an agricultural landscape characterized by lots and lots of corn? Here's the possibility I've been investigating. After harvesting an ear of corn for its grain, there's a lot of stalk or stover biomass left behind. While we think a cricket would struggle to make a nutritious meal out of an old corn stalk on account of there being too much hard-to-digest lignin and cellulose, a white rot fungus like oyster mushrooms will readily grow on such a substrate. In culturing corn stover with this fungal middleman, lignin in the stover gets busted up and digested by fungal enzymes, and the fungus concentrates a lot of the good stuff, the proteins and amino acids, into its own tissues, while losing less desirable carbon to respiration. We think this fungally enriched corn stover may have potential as feed adjunct for these insects, enabling them to gain weight more quickly and to possibly offer more nutrition to human end consumers. An added economic and nutritional benefit to this proposed model, of course, is the simultaneous production of edible mushrooms, which are nothing more than the reproductive structures of the fungal mycelium doing all that heavy lifting, breaking down the lignin in that over. So a lot of the substrate preparation took place in my backyard, where to the unanimous delight of all my neighbors, we installed a low-tech propane-powered mushroom pasteurizer constructed from a recycled ethanol barrel. Once pasteurized and inoculated with fungus, we transferred these maize-stover substrates to the lab, where substrates were cultured to induce variable fruiting effort between various treatments. We then dried it, ground it into cricket feed, and measured as response variables the cricket size, their weight, and their body condition over time. At the end of March, we completed our feed trial and are now working to analyze growth performance data. Our collaborators at Colorado State University are analyzing cricket biomass for zinc and iron and other critically important micronutrients. In closing, I'd like to thank the following people without whom this work would have been impossible, pandemic or no. These are Susan Paskowitz, Valerie Stull, Michael Bartlett-Smith, Tim Lorenz, and Genevieve Beckrow. You each have my profound gratitude for the guidance, support, and hard work you've contributed to these efforts. Thank you.
Martin, thanks so much. And you're doing this, growing these in your backyard reminds me that when I was on sabbatical, Valerie Stull grew those crickets in my office, or the mealworms in my office.
How great is that?
So I have a question for you. Growing these insects is still, growing animals, and why not just promote vegetarian diet, including, nutritional plants and fungus? What's the benefit to insects as far as reducing food insecurity?
Oh, well, that's a devastatingly great question, Jonathan. It's really a challenging one. And the rationale for this work has to do with some of the novel attributes of insects, such as very short generation times. So, one is able to grow insects in, for example, the cricket that we work on, Gryllus bimaculatus, we can rear an entire generation of them in about 50 days. So in situations where environmental catastrophe has occurred and food supply is needed in very short timeline, that may be one very good rationale for why we would grow these. Another is the diversification of farming, we want to have diverse polycultural agricultural practices, and insect agriculture almost by definition contributes to the diversification of farming. And lastly, they're very good for you. Valerie Stahl, who was thanked in my talk, has done incredible work looking at the ways that insects benefit or seem to benefit the assemblage of human gut microbes. And they are extremely nutritious and seem to have some very compelling health benefits.
Right, and valuable micronutrients are really important, especially in poor countries. So thank you, Martin, fantastic. Our next presentation is from Sheila Sakarian, who is advised by Andrea Hicks in the School of Engineering. Sheila, let's see your video.
Hello everyone, my name is Sheila Temzel Shakarian. I recently graduated with a PhD from the Department of Civil and Environmental Engineering at the University of Wisconsin-Madison. My research focused on the environmental implications of emerging technologies, nanotechnology as a case study, supervised by Dr. Andrea Hicks. I am very happy to be in the Planetary Health Scholars Cohort for the fall 2020. In this flash talk, I will be sharing my research with you. Due to their size-dependent properties, engineered nanomaterials perform either enhanced or different functions compared to their bulk counterparts. Considering silver as a case study, let's see how conventional silver and silver nanoparticles take part in our lives as embedded in various products. Silver has been utilized since antiquity due to its antimicrobial efficacy. Conventional silver plates were used to promote wound healing. In the 19th century, silver thread was utilized in surgeries. Also, silver nitrate eye drops were used in newborns to prevent neonatal blindness. Nanoscale silver is gaining attention for its antimicrobial properties. It is expected that the global production of nanosilver will increase from about 210 tons per year in 2020 to about 800 tons per year in 2025. Market reports also support this significant growth. Some examples of nanosilver-enabled consumer products include medical applications, textiles, cosmetics, and food storage containers. We saw that these nanomaterials have already started to take part in our everyday lives. It would be good if we could understand their environmental and human health implications. Therefore, my motivation behind conducting this research is understanding how the materials that we use in modern society can affect the environment and informing product developers about the ways to design materials that have less environmental and human health impacts. So my aim is to quantitatively evaluate the environmental and human health impacts of nanosilver-enabled consumer products. But how? The answer is by using life cycle assessment. Life cycle assessment is a tool to evaluate the environmental impacts of products throughout their life cycles from raw materials acquisition to end of life, including manufacturing and use stages. Here, the green arrows indicate the inputs, which represent any energy and material needed to manufacture, use, and dispose the product of interest, and the red arrows indicate the outputs, in other words, the emissions and wastes generated as a result of these stages. Before providing the results, I would like to share some terms that I will use throughout my talk. As I previously stated, these red arrows represent the outputs. However, specifically for the nanomaterial-enabled product, there is an additional output flow represented by blue arrows here, which indicates potentially released nanomaterials throughout manufacturing, use, and end of life. Essentially, red arrows indicate indirect emissions or non-nanospecific emissions, and blue arrows indicate direct or nanospecific emissions. This will be calculated separately for holistic evaluation. Following quantifying the impacts of making the nanosilver, now it is time to calculate nanospecific impacts. For this, we need to calculate a component called characterization factor. I would like to define characterization factor by sharing an example. For instance, if we think about mass scale, 1 kilogram of carbon dioxide is equal to 1 kilogram of methane. But if we think their contribution to global warming, methane contributes about 25 times more than carbon dioxide. So here, 25 is the characterization factor for methane. Previous life cycle assessment studies modeled nanospecific impacts resulting from the nanosilver release as ionic silver, which potentially resulted in overestimations of the impact. With this step, we wanted to shed light on this evolving debate. To calculate characterization factor for nanosilver, we used U-Stokes methodology. This is a consensus model which provides a framework for characterizing human toxicity and freshwater ecotoxicity impacts of inorganic and organic chemicals. It has three components: effect factor, fate factor, and exposure factor. In order to combine the factor that we developed with non-nanospecific emissions, we conducted life cycle assessments for 4 commercially available silver nanosilver enabled polyester textiles with different initial silver nanosilver loadings. T, E, A, and C indicate different textiles, as C having the largest silver content. We also compared different laundering scenarios. Results show that unless the initial silver loading per textile is significantly high, nanospecific ecotoxicity and human health impacts would be lower than non-nanospecific ecotoxicity and human health impacts. In the majority of instances, nanospecific impacts are found to be much lower than non-nanospecific impacts. Although modeling nanosilver release as ionic silver likely results in an overestimation of environmental impacts, it may still be applicable as the overall results are not sensitive to the release. With this, I would like to thank you for your time and interest to my research. I would be happy to answer any questions you may have. Thanks again.
Sheila, great. Thank you so much. And I do have a question regarding the human health impacts. How is it different as far as assessing human health how you characterize human health impacts compared to the environmental or ecotoxicity of mercury?
So the ecotoxicity characterization factors are calculated based on the freshwater species like crustaceans, fish, and other freshwater species. But the overall calculation scheme would be the same. We should have effect factor, fate factor, and exposure factor for human health too. But the human health impacts include doing some experiments on, let's say, mice, rabbit, and other not freshwater species, but other lab-based, unfortunately, species. So we need to have this information and to calculate the toxicity for informing effect factor. And then for the fate factor, there are different routes that these nanomaterials can be inhaled or in whatever fate route they can select. So the overall calculation scheme will be the same, but working on different species will be required to have the impacts. My part in my PhD research was based on freshwater ecotoxicity impacts. So for the human health, we need more toxicity information to calculate those factors.
Great. Thank you, Sheila.
Sure.
And speaking of environmental toxins, let's go next to Ben Giuliano, who talks about adverse effects to insects in agriculture. Ben, and he's advised by Claudio Graton in Cal. So take it away, Ben.
Hello, my name is Ben Giuliano, and I'm a PhD candidate in the Department of Integrative Biology. I'm going to give an overview of my research promoting healthy agricultural landscapes for insects and people. When you look out across the landscape in most of the world's major agricultural production regions today, you might see something like this. Agricultural landscapes are increasingly being simplified. They retain little natural habitat, produce relatively few types of crops, are composed of large monocropped fields, and require high levels of chemical inputs. This simplification is associated with a host of negative outcomes for the environment, agriculture, and public health. In particular, it's been linked to declining populations of some insect species. what is sometimes hyperbolically dubbed the insect apocalypse. Beneficial species are especially vulnerable, while pests thrive in simple environments. This contributes to a pesticide treadmill, whereby insecticides are applied to respond to an outbreak. In the process, the natural enemies that eat these pests are killed, contributing to the outbreaks of secondary pests. Pests may also evolve resistance to the pesticide. A new pesticide must then be developed, which is increasingly difficult and costly to do. In addition to their consequences for wildlife, pesticides also pose a threat to people, especially agricultural workers and the communities around intensively managed fields. In response to these problems, many scientists and farmers seek to promote natural pest control by augmenting habitat for the natural enemies that eat crop pests. Because such organisms are mobile, understanding what they need to thrive requires thinking beyond individual crop fields, such as the one outlined in black here. Throughout their life cycle and across generations, insects may use resources from other fields on the same farm, outlined here in white, or other farms in natural areas across the landscape, indicated here by the blue arrows. More complex landscapes may benefit natural enemies in a variety of ways, but my research focuses on how it affects the continuity of key resources over time. For example, a simple landscape with just a couple of types of crops grown may leave gaps over the course of the season, shown in the bottom left. During these times, natural enemies could starve, limiting their populations. In contrast, a landscape with diverse crops and natural vegetation may provide continuous resources across the whole season, as shown in the bottom right. My research investigates how these expected dynamics play out in the real world right here in Wisconsin. I focus on lady beetles in my research, and this cartoon does a great job illustrating why. They're a charismatic group that many people are familiar with, but they also are voracious predators of aphids and other soft-bodied agricultural pests. My research addresses three broad questions. First, how and when are lady beetles using prey resources across the landscape? Second, can we design cropping systems at field and landscape scales to promote natural pest control? And third, what do farmers and other land managers think about landscapes, insects, and habitat management as a pest control strategy? To answer these questions, I use a variety of different methods. I use land cover data from the USDA to analyze and select landscapes in Wisconsin that have varying levels of complexity. I then conduct surveys of lady beetles and their prey in these landscapes to look for patterns over the course of the growing season. I also take measurements of lady beetle diets and fitness to better understand what they're eating and what the consequences may be for their populations. Finally, I'll be conducting interviews with Wisconsin farmers to learn about their pest management practices, whether they include beneficial insects in landscape design, and if not, what their constraints or limitations might be. I'll be completing my second year of data collection this summer, so stay tuned to find out what I discover. A planetary health lens is incredibly valuable for helping us draw the connections among insects, agriculture, landscapes, and people. Ultimately, I contend that planetary health necessitates working with nature to maintain an adequate food supply for humans while reducing toxic pollution from agrochemicals and conserving the diverse species, especially insects, upon which we depend. Thanks for listening, and please get in touch if you have any questions.
Ben, thank you very much. So how do you measure the insect diets?
Yeah, thanks, Jonathan, for the question. So we are able to collect specimens out in the field when we're doing the field work that I described, and then actually use genetic sequencing methods to basically analyze the guts of those beetles that we collect and then find unique sequences of DNA that are specific to the particular prey that they may be eating, and then use bioinformatics techniques to identify them, it's all a new thing for me, but it's a very cool technique that I'm excited to be learning, and hopefully we'll learn some cool stuff from.
Sounds like great technology. Thank you. All right, let's move on. We're still 4 minutes behind. We didn't gain any. Okay. Yaa Oparebea is studying zoonotic diseases and deforestation, and her advisor is Maria Lepowski in anthropology.
Hi everyone, I am Yaa Oparebea, a third-year student in cultural anthropology, and I explore the local socio-ecological specificities of zoonotic diseases. According to the World Health Organization, a zoonosis is an infectious disease that has jumped from a non-human animal to humans. Zoonotic pathogens may be bacterial, viral, or parasitic, or may involve unconventional agents and can spread to humans through direct contact or through food, water, or the environment. They are considered a major public health problem around the world due to the close relationship between humans and animals as agriculture, as companions, and in the natural environment more broadly. Zoonosis can also cause disruption in the production and trade of animal products for food and other uses. Examples of zoonotic pathogens include the HIV, which began as a zoonosis but later mutated into human-only strains, the Ebola virus, or the novel coronavirus that causes COVID-19, as well as parasites such as the Plasmodium parasite, which causes malaria. The One Health framework ranked zoonosis as a critical threat to global health and human security. While prevention methods for zoonotic diseases differ for each pathogen, standard health protocols for zoonotic disease prevention focus on personal and environmental hygiene practices and safety guidelines for livestock care. At present, one of the fundamental paradigms of the zoonotic disease prevention is the emergence framework, which looks at the relation between humans and the animal and marks the spillover event, namely, the moment or context of virus transfer from the animal to the human. Yet the focus on the spillover event often approaches zoonotic diseases as decontextualized phenomena. As many scholars have argued, the One Health framework, as well as conventional global health approaches, tend to address interspecies relations as pathologies, marking these into the narrow categories of positive or negative. This approach, which focuses on safe and sustainable interspecies relationships, has been interpreted by some scholars as a rather neo-colonial take on interspecies relation, effectively consolidating species taxonomies and the configuration of global health, misinterpreting webs of causality, and rendering sociopolitical hierarchies invisible. My research aims to contribute to these already existing critical approaches by focusing on local biologies and ecologies that underscore multiple origins and entangled webs of causality or conditions of possibility for the development of zoonotic diseases. My anthropological research in Indonesia, on the island of Sumatra, investigates the process of relocation of formerly dwelling communities in the context of deforestation and the extension of industrial monocot plantations. I seek to understand how land use change reconfigures interspecies relations in ways that enable the transmission of zoonotic pathogens. I hope to capture the key local, economic, political, and environmental factors that place both humans and animals in precarious positions and that orient or sustain relationships that would encourage the transmission of pathogens. While scientists have shown the link between deforestation and zoonotic disease, my research hopes to capture the processes that help materialize zoonotic pathways of transmission. I focus, for example, on changing dietary practices and resource management, the adoption of new economic activities such as agriculture or wage employment, and emerging patterns of settlement along the forest edges. I also aim to understand how the process of relocation mediates culturally contingent notions of interspecies relations in ways that enable or prevent zoonotic entanglements. At the heart of my research lies a social justice-informed approach to planetary health. A critical aspect of my research investigates how the racialized contingencies of capitalist extraction, in this context deforestation and the expansion of monocrop plantations, contribute to the sustained precarity of local populations and actively enable the transmission of zoonotic pathogens. I'm looking forward to conducting my ethnographic research on the island of Sumatra in Indonesia, and I'm very grateful for the financial support I received from the Global Health Institute, which will make my research possible. Thank you.
Thank you, Yaa. I have a question about how local global health activities against zoonotic spillover may place indigenous communities at higher risk.
Yeah, thank you for the question. So, well, essentially, contemporary global health approaches to zoonosis tend to think of interspecies relations as positive or negative, and which are often qualified according to Eurocentric frameworks of biosecurity. So there is very little attention in this framework to the wider processes that place humans and other species in relations that are conducive to the transmission of these kind of pathogens. And as I mentioned in my presentation, these wider processes are direct responses to the demands and activities of racialized extractive capitalism, like industrial deforestation and monocrop plantations. So these relations, by taking these relations out of context and often racializing them, global health approaches to zoonosis essentially misinterpret webs of causality. They misplace the blame on indigenous communities. And by virtue of all the measures aimed at biosecuritizing both humans and animals, actually contribute to these kind of conditions of precarity because they further limit the financial and social mobility of indigenous communities.
Great, thank you. Well, now let's stay international. Our next speaker, our next scholar is Yaa Ampofo, and she is advised by Nancy Kendall in the School of Education, talking about environmental health in Ghana.
Hello, everyone. My name is Yaa Oparebea Ampofo, and I'm a third-year PhD student in the Department of Educational Policy Studies. My work looks at the faith-led response to environmental change in Ghana. I want to start by showing two maps. On the left, a fairly common map, people living in sub-Saharan Africa face some of the world's highest vulnerabilities to the various economic and social effects of climate and environmental change. On the right, another map showing median age across the globe as of last year, with sub-Saharan Africa holding the youngest population. It is predicted that over the next 3 decades, Africa's youth population will grow as other regions decline, and by 2050, 1/3 of global youth will be in sub-Saharan Africa. Together, these maps tell an important story. They position young people in Africa as an extremely high-risk group in the climate crisis. And in response to these realities, interest in supporting African youth in learning about and in adapting to environmental change is growing. Many of these conversations, happening mainly in the international development space, have turned to the education sector to do this work. However, these primarily school-based approaches have been critiqued for being highly individualized and for perpetuating developmentalist and therefore extractive orientations towards the environment. They are also shown to be quite decontextualized from local socioecological conditions and cultural understandings, particularly in non-Western settings. In other words, they rarely consider how messages about ecological change might intersect with or respond to people's lived experiences or acknowledge the heterogeneity of these experiences. And so while these dominant approaches continue to center formal school settings in their efforts, we know that spaces of ecological knowledge production and learning extend well beyond the boundaries of schools. Which brings me to the case in Ghana and where my study emerges. Right now, Ghana finds itself on the verge of an environmental crisis and has been ranked among the top 10 countries most affected by climate change already. At the same time, in another set of rankings, if you will, various studies consistently place Ghana as one of the most self-reported, highly religious and devout countries in the world. So by this alone, it's not so surprising that environmental movements led by faith-based groups are growing and increasingly capturing broad public attention. Traditional religious leaders have called for a return to indigenous beliefs and practices of ecological reverence and of kinship, while many Christian and Islamic groups are centering biblical and Quranic notions of human care and stewardship over the rest of creation. So when I started this research, I was interested in this faith ecology education nexus and how it was unfolding in Ghana. But over the past year, what has emerged in my research is a particular focus on youth at the center of these interactions. These faith-based movements are specifically developing a large following of young people. Turns out Ghana's religious population is composed of a majority of devoutly religious youth. A 2018 study by the Pew Research Center, for example, records Ghana as only one of 2 countries globally where young people are more likely to identify as religious than older people. My work therefore looks at how youth in Ghana learn about and think about human-earth relations against the backdrop of faith-based settings and within the context of themselves as a highly at-risk climate change population. Specifically, I'm asking, how are notions of human-earth relations and socio-environmental change constructed across these youth-centered and faith-led learning spaces? And how do these spaces conceptualize and enact their environmental education efforts? And I'm hoping to get a sense of to what ends. My research will explore how these different and diverse representations of ecological knowledge are understood, are experienced, and perhaps even contested by youth in Ghana, and how these heterogeneous and in some cases hybridized approaches are conceptualizing all of these notions. A renewed focus on faith and ecology with youth at the center forces us to consider how people think about notions such as kinship, agency, community structures, ideas that are on one hand fundamentally mediated by faith-based perceptions and practices, and on the other hand, critical building blocks of our engagement with the planet. So it is important to understand how youth are learning to constitute these relations in different spaces. Exploring how these faith-based spaces shape their approaches to environmental education and to that effect shape youth perceptions speaks to how we might imagine radically different pedagogies, radically different policies for supporting youth across the continent in managing their own needs and the needs of the planet. At the same time, in capturing and mapping the work of these learning environments important to youth in Ghana, we can also have a serious conversation about how the structures of environmental education have been intertwined with historical and contemporary global disparities in the practices of knowledge production. My goal is to widen the lens through which we might examine how education has been deployed as a tool in our response to the ecological crisis. And I look forward to doing some more data collection soon. Thank you all so much.
Yeah, thank you. Really interesting. And I wonder, you talk about faith-based approaches to the environmental crisis and school-based. Now, these could be dealt with separately, but do you see opportunities where there can be some hybridization or these two efforts coming together between schools and faith-based approaches?
Yes, thank you for saying that, for asking that, Jonathan. So I think one of the points that I wasn't able to raise in my talk is that faith-based institutions they do have sort of ideological power, and they have the power, or they have the ways to influence the way we think about people's behaviors, people's political actions. But what we don't talk about, and what's very common, especially in sort of post-colonial settings like Ghana, is that religious institutions also have institutional power. They also have a lot of infrastructural power. So they may be influencing they may be having an impact on people's belief systems, but they also have structural power in enforcing what kinds of things are taught in schools. We've seen, especially with the history of schools following the missionary tradition in many countries such as Ghana, churches and a lot of Islamic institutions still have a lot of power to influence what actually gets taught in schools, because they are defining a lot of the discourses that are happening in the public space. So the work that they may be doing at a congregational level actually does spill over into a lot of our state-led approaches to the educational response.
Great, thank you. Okay, one last international oriented talk. Rebecca Alcock, who's advised by Justin Boutillier, is going to be talking next about electrification in low and middle income countries. Take it away, Rebecca.
I invite you all to imagine with me for a moment. Picture a hospital room. When I do this, I see a patient room within an ER. There's a bed, a computer, typical tools like a blood pressure cuff and an otoscope. The lighting is a little harsh. For most of us, the hospital room you pictured probably looks something like this. And I bet that the last time you were on the way to the hospital, whether seeking care for yourself or a loved one, or providing that care, you weren't wondering if, when you arrived, the facility would have electricity. But for many, this is reality. The facility they rely on for essential healthcare services does not have electricity or experiences unpredictable power grid failures. Non-electrified healthcare means that advanced diagnostic tools like medical imaging or life-saving treatments like mechanical ventilation are not practical. Equipment used to continuously monitor a patient's health is unavailable, communication and documentation become increasingly difficult, and having refrigerated medications or vaccines is simply not an option. Unfairly, this means the greatest innovations to improve human health of the past decades are not at the disposal of the healthcare workers nor accessible to the patients. Perhaps most importantly, however, limited to no electricity in health clinics means there is no modern lighting. The very thing that allows health professionals to more closely examine the wound on a patient's leg, to perform a safe procedure, or to simply work past the daylight hours becomes a potentially dangerous endeavor. Without modern lighting, clinics resort to more accessible forms of light, like kerosene lamps, candles, or flashlights. Though I wish it were, this is not an exaggeration. 1 billion people receive healthcare in a facility completely without electricity. Even more receive healthcare at a facility with unreliable electricity. And thanks to climate change, even more people yet will fall into this category in the coming decades as we experience an increasing number of adverse weather events. For the greater than 1 in 8 people who face this reality, the consequences of non-electrified healthcare are inconvenient at best and fatal at worst. In fact, when clinics don't have access to reliable electricity, there are serious health implications for their communities, including increased mortality, higher incidence of disease, and overall poorer population health. And like almost everything, the world's countries aren't bearing this burden equally. The crisis is largely affecting low and middle income countries where poor health and inability to access appropriate care compound on other fragile systems and reinforce the inequities that maintain countries' current positionings on the scale of economic and social development. So what can be done? We propose a vehicle to microgrid system. Let's break that down. A microgrid is a localized, standalone energy system that typically uses 1 or more renewable energy sources to supply power to only a small group of loads. Such systems reduce facility susceptibility to traditional power grid failures and provide them with the autonomy to establish custom operational structures. Electric vehicles have been proposed as an additional tool to increase resiliency of microgrids. The very basic idea is that the vehicle batteries can be used to supply backup power to the facility during outages or times of high demand, and are charged on the same system during optimal conditions. In our case, we are interested in micro-mobility specifically, which just refers to smaller, more lightweight vehicles like electric bicycles and electric motorbikes. The bikes can be leveraged to provide a wide range of services beyond improving microgrid reliability, shown here. And the motivation for using bikes and motorbikes in particular versus electric cars is that they have already proven to be effective tools for health delivery in rural or resource limited settings. Right now, we are in the final preparatory stages for a local pilot in partnership with the student organization FH King Students for Sustainable Agriculture. They have provided us space on their farm to host a scaled version of the system, allowing us to collect operational data that will inform future models, as well as vet and improve the more novel aspects of the system prior to applying it in a global health setting. At the end of the harvest season, we will be transitioning to the modeling phase of the project, where we will employ a combination of optimization and machine learning techniques to uncover the optimal design of the vehicle to microgrid system. And lastly, we hope to parlay the results of the pilot project to obtain funding and secure a partnership with an interested health clinic for the remainder of the work. Overall, we believe that improving both human and environmental health via clean health clinic electrification will not only turn this into this, but also increase clinics' operational capacity, help retain skilled employees in rural areas, increase patient confidence in the health system, and therefore increase utilization of the health system. All major impacts that result from the proposed micro solutions. Thank you.
Great. Hey, Rebecca, just because Dave Epstein graduated out of electrical engineering, I want to just ask you a little more detailed on optimizing across the vehicle microgrid system. Can you just say a bit more?
Yeah, thank you. Let me explain. Basically, we want to minimize the size and therefore the cost of the vehicle to microgrid system while ensuring a few things. First, most importantly, the system must be sized such that in any event, a minimum viable clinic is electrified. So for example, if there's a natural disaster, our system must be robust enough to maintain lighting, communication, refrigeration if applicable, and then a select subset of medical devices. And secondly, we want to size the system such that there are not only an appropriate number of bikes to supply that backup power, but also to accommodate the mobile activities that were described in the video. So along the way of that optimization, we will find out a few things, like if we should incorporate stationary power like wall batteries in addition to the bikes, and then like how many kilowatt hours our solar PV system should be capable of producing, and a number of other design variables.
Great, thank you. Well, speaking of bikes, let's turn to a topic about urbanization and urban design with Lisa Charon, and she's advised by Jim Legros in architecture and what's the department again? It's landscape architecture,
and urban
planning
design.
and landscape architecture, right? They merged. Okay, take it away, Lisa.
I want you to think about your neighborhood. Pick a place you go regularly, your workplace, or maybe the grocery store. How do you get there? If you wanted to walk or bike there, could you? Now, a lot of you are probably thinking, well, that's just not possible. If that's you, then what is standing in your way? Think critically about the route you would take. Maybe your destination is simply too far away. It would take too long. Or maybe your route looks something like this. A busy road with multiple lanes, narrow sidewalks, no safe crossings, no shade, and frankly, little beauty. As Mitchell Jorsted tweeted so effectively, this outside that has been built over decades is a huge barrier to the proverbial going outside, playing and being active in our communities. This, combined with a food system that prioritizes cheap, fast, abundant calories over nutrition, has dire consequences for our health. By 2030, it has been projected that almost half of all US adults will have obesity. And obesity increases the risk of some of the top killers in the US: heart disease, cancer, stroke, chronic lower respiratory disease, diabetes, and yes, even COVID-19. But the implications of the way we've built our environment do not stop with population health. They extend to the health of the planet. Our recent Lancet Commission on Obesity identified transportation, land use, community design, and agricultural systems as the 4 common drivers of both obesity and climate change. They call for comprehensive actions that explicitly address both obesity and climate change as 2 intertwined pandemics that represent the paramount health challenge for humans, the environment, and our planet in the 21st century. Urban, rural, and regional planners have an opportunity to disrupt these common drivers at the local level, and in doing so, to create places where it's easy to be physically active, eat healthy, and promote planetary health. That's why my research is looking at one of the most essential tools that American planners already use to develop their cities, towns, and regions: the comprehensive plan. Comprehensive plans guide the built, social, and economic development of a community. They provide a vision developed by the community for what it wants to look like in the next 10, 20, or 30 years. This is a time for the community to dream up a new future, something that's really important when we're thinking about big systemic changes. They contain a blueprint of specific policies, strategies, and projects for then making that vision happen. Writing a comprehensive plan is a process that has education, engagement, and consensus building components. In Wisconsin and 33 other states, other planning policies like the zoning code has to be consistent with an officially adopted comprehensive plan, giving the plan legal standing. And what I think is most important, comprehensive plans are holistic. They cut across departments and sectors that would otherwise work pretty independently. And this is really important because big problems like obesity and climate change require cross-sector collaboration and alignment. So I'm exploring how much healthy eating and active living show up in comprehensive plans, if this can lead to better health outcomes, and how local planners can begin to move the state of the practice forward. Now think back to our first thought exercise. Remember when I asked if you could walk or bike to work or the grocery store? Some of you may have thought, well, hold on a second, Lisa. I actually can walk or bike there. That's great. Maybe your route looks something like this or like this. For some of you, walking or biking might not just be possible, it might be the most convenient, the most fun, and the most beautiful option. If that's so, I'm willing to bet you right now that if you dig up your community's comprehensive plan, active transportation like walking and biking will feature prominently. It's my hope that through more plans like that, that make it their objective to build places where it's easy to be active and eat healthy, we can make local level changes that have big payoffs for planetary health. Thank you.
Thanks, Lisa. So do you have any preliminary data yet on, healthy eating or active living since you did this?
Yeah, thanks for that question, Jonathan. Yeah, I was able to systematically assess a sample of 116 comprehensive plans from Wisconsin. They were urban and suburban comprehensive plans only. We didn't go into rural communities, but we found sort of fair to moderate levels of healthy eating and active living in these comprehensive plans. What I think is most interesting is it's variable across different domains. So active transportation actually shows up quite often in Wisconsin's comprehensive plans, while things like healthy food systems doesn't show up that often. And I think most importantly, the overall vision and strategy of connecting the built environment to health and obesity and behaviors like healthy eating and active living, most comprehensive plans don't make that connection explicitly. And so I think there's an opportunity to talk to Wisconsin planners about making that connection.
Great, thank you. Okay, so our last speaker is Daniel Hayden. And one thing to remember that for planetary health, the indigenous ways of knowing, indigenous approaches and thinking across generations is absolutely core to what planetary health is. So it's, I think, appropriate for Daniel to give the last talk. He's in plant pathology and his advisor is Professor Richard Landcal. Daniel?
Hamadawika. My name is Daniel Hayden. I'm a PhD student in the Department of Plant Pathology at the University of Wisconsin-Madison. My project is working with indigenous growers here in Wisconsin on increasing their cropping system diversity while reducing the input and labor requirements in their systems without sacrificing yield. And they're working with their own culturally significant indigenous corn varieties, like you see in the picture right here. And I'd also like to acknowledge we are on stolen indigenous land. The work we do is on stolen indigenous land. There are 12 tribes in Wisconsin. And just us working and being here at UW-Madison comes at the expense of indigenous people through the Morrill Act of 1862, which established land-grant universities through stolen indigenous land being given from the federal government to Oh no, we missed the best part.
Logan, can you do something there? Daniel, you want to say something?
Oh no.
Okay, go ahead, Logan, restart, go ahead. Go ahead, Logan.
So this picture on the left is where it's from Oklahoma. That's where I was born and raised. It's on a prairie, and we see lots of going on. There's flowers, there's grasses, there's shrubs, and guys are watering. Prairies are so diverse because there's so many different organisms, so much life. Each one contributes its own unique, input into the system. Each one does a different thing, and so the system is able to be a closed system. Like these things naturally sort of happen. These natural ecosystems naturally maintain themselves. This is juxtaposed to
Let's see. I'm not,
agricultural
While
systems.
Logan's trying to
Where
figure.
we see in the picture right here,
Oh, go
low
ahead.
diversity, there's only one crop being grown, and high input. Because there's low diversity, there's a requirement of high input. That's why we're having issues with nitrate runoffs in rivers, with with water issues and shortages in certain states. And so now we sort of have this idea, maybe we should replicate what we see in natural ecosystems, our ag ecosystems, because we don't need as much input. And there's no amount of input in natural ecosystems as in ag. And most, there are practices now, such as through organic or sustainable ag, that recognize this. However, it's important to note that although the farming and research communities are sort of increasingly recognizing the critical role of having diverse cropping systems on their own systems' health and resilience, Indigenous peoples have also understood this role for generations, and embedding it in their own traditional knowledge systems and surrounding agriculture and land stewardship. So, who better to work with to answer these questions than Indigenous people in Wisconsin, which is what we're doing now. And so, I'm working with Ohelugu, which is a NIDA agricultural co-op focused on growing a culturally significant white corn, Metaconicum, which is a Menominee nonprofit which focuses on many social issues, but also food sovereignty and food justice. I'm working with Dan Cornelius also, who is near Madison. He's an Oneida corn grower. There are also future partners are Ho-Chunk Organic Farm, Whirling Thunder, and the College of Modern Nation, their ag program through Dr. Frank Kutka. And so we're really key is focusing on this whole project is making sure that Indigenous people are leading this discussion, they're leading the research questions, they're asking the questions, and then we answer them, for them, and we decide from there what's best for their growing systems. And so what we're doing exactly is we're hoping to build upon the traditional knowledge of Indigenous people and create a connection from healthy soils, healthy food, to healthy people, which parallels the goals of Indigenous food sovereignty for tribes to feed their people with culturally significant food. It can also be parallel too with stuff like global and planetary health as well. And so we're going to do this through the use of organic cover crop based reduced tillage practices, which mitigate the harmful effects of tillage when they stir up the soil before they plant anything. And we want to do that. We want to reduce those effects while promoting soil fertility, weed suppression, and microbial diversity in the soil. And so what we're doing now will decrease the need for outside inputs and save money and labor time for tribal community members like Ohelugu, like Metaconica, and like Dan, who can now focus on other aspects of their lives, food sovereignty initiatives also. And so here's sort of an example of what we're looking at now. We have the cover crops growing between the corn right there. And also the idea is that perennial cover crop systems, you can come back next year, for example, spring 2021, and it'll still be there. So you can just plant right into that again. So far we found our research that, increasing these mixtures generally do better at suppressing weeds. So making your system even more diverse is great. So while not innovative in itself, these practices haven't been really cited with Indigenous corn. This project bridges these two worlds of understanding to fill that gap: Indigenous grassroots farming and extension research.
Great. Hey, Daniel, sorry for the technical problem. When I viewed it, it was perfect. It was perfect. So listen, just maybe you can fill in the gaps by just telling us how you see this project evolving after you finish the scholars program.
Oh, we currently have a planning grant, organic research and education planning grant, that's sort of assessing what native growers need here in Wisconsin. We're pretty sure we'll get funded, so that'll be nice. So then we'll have sort of a baseline idea of because there's a lot of like research with Indigenous communities here at UW, but it's all like very like non-centralized at all. So like hopefully through this planning grant and through sort of that, we'll be able to sort of cohesively understand like what the needs are, because a lot of Indigenous growers, like, they have the mindset and the knowledge and the values, but at the end of the day, people need to learn how to what equipment they need, what inputs they may need from outside. So we're just trying to like combine the best of both worlds and knowledge systems essentially. And so I'm hoping the project just garners more collaboration, like more people at UW are willing to work actively in this program as well. So.
Great. Thank you. So I see a lot of questions coming in, and I'm going to try to condense some of them. And also, Monet posted a link in the chat to Daniel's talk if you want to see it without any interruption. The link to Daniel's talk is there. Sorry about whatever technical problems we had. So quickly, so all of you guys pay attention, because these are multiple of you. So Jules, one question coming in, looking at trade-offs between resilience of our food system provided locally versus the resilience provided by global food networks. If one region has a climate disaster, another region far away can help out. Think about that. And another question across to those working in entomophagy, do insects spread food diseases like Listeria or Salmonella? So Jules, you have 30 seconds, and then anyone else, Ben or Martin, another 30 seconds. So quick answers.
All right, I'll try. It's a great question, and it speaks to the tension in our definitions and conceptualizations of local resilience. One response that I have, so yes, there's a trade-off. We are trying to explore this idea of multi-localism, where we support other local community food systems that are, resilient in and of themselves, rather than a globalized food system. So, if we get a shock to one area, one local food system, we have that partnership and that support with another resilient and strong local food system.
Martin and Ben?
So, taking a step back, it's really appropriate to ask questions about food safety when you're approaching some, essentially novel component in a diet. If I'm here saying insects are going to be the next big thing in human diets or in Western diets specifically, then we need to address a whole suite of questions, both microbiological and outside of that as well. So a big issue indeed is the typical things like Salmonella, Listeria, those that were mentioned. Additionally, allergy risks are extremely relevant to questions of insects as food, because they are, of course, closely related to to the crustaceans. They are arthropods and contain a lot of the same kinds of allergens that can cause severe reactions in people. And finally, in wild collected insects, there are serious risks of pesticide contamination. So that I didn't even mention that in my little rationale for why perhaps pivoting toward farmed insects versus wild collection may be a good idea. But certainly if you don't know where your insect is coming from, there's a decent risk in a lot of parts of the world that it has consumed something treated with pesticides, and that can be a problem.
Okay.
Jonathan, could I just jump in quickly on that question too?
Okay.
So moving away from the edible insects, some insects can also carry foodborne pathogens like Salmonella in like vegetable cropping systems. There's been research here at UW showing that like aphids sometimes can do this. I would recommend specifically, there's a grad student in the entomology department, Vicky Laison, whose research is all about this. But the other thing I'd say is that those tend to be the pests that are carrying the diseases within the crops. And there is evidence that predatory insects and other insects like dung beetles actually are really effective at cleaning up basically the diseases or the poop that may be around in those ecosystems that are spreading those diseases from like manure or something. So I think it really matters what insects we're talking about, and we need to figure out management strategies to keep around the good ones and minimize the bad ones.
Great, thank you. So I'm going to bundle the last two questions for the sake of time. This one is for Yaa. Could you please say a bit more about the idea of agency in environmental protection from the religious perspective in Ghana, and perhaps if there's a difference between the traditional religions, Islam and Christianity? And then one final quick question for Daniel. The question is, were those cover crops or also food crops that you're talking about? So Yaa, and then Daniel, and then we're going to go to some big announcements.
Yeah, I'll be quick. So, and without overgeneralizing, because especially when it comes to Christian tradition, there are even extra, like additional differences within, like the Catholic Church is very institutionalized in particular ways, and then more sort of neo, sort of hybridized African Christian traditions are different in particular ways. But I would say when it comes to cultivating ideas about agency or responsibility or action, they all have very different starting points. So you'll notice that a lot of the traditional religions will cultivate the notion of our agency or action based on ideas about kinship or particular forms of ecological reference, which are quite different from like Christian and Islamic traditions that frame the notion of agency as a response to either our Christian or Islamic mandates to, you know, to be stewards and have dominion over the earth. And even though both of those may sort of be coming to an end goal of environmental protection, I think the starting points matter in how they frame, you know, what kinds of actions should be taking or what kinds of issues should form priorities. So yeah.
Professor Buravalova, I hope you're satisfied with that answer. Okay, good. Okay, Daniel, question to you.
No, they aren't food crops, and that's just sort of a trade-off where, you know, if they were food crops, then, you know, it's potentially an annual crop, potentially more work you have to do to, you know, harvest and plant. So I think the benefit with cover crops is that, you know, it's low input, constant cover, and then also you can really go ham with those mixtures and diversity. There are some that have like 10 different plants, and it's just like really interesting. So yeah.
Great. Well, thank you. And we're now only 2 minutes behind, so that's good. So I just want to, in closing, how about everyone give a virtual round of applause for all of our scholars. I think you'll agree that they've done an amazing job and are a beacon of hope for a healthier future. Yeah, I'll do the real ones. I'll do the real clapping. Yeah, okay. So I promised you 2 announcements before we move on. So if we can share the screen again for, here we go. This is to announce our new 2021-22 cohort of Planetary Health Scholars. Here they are. We have 5 new scholars, and I'm not going to read their names, but there they are. You can see them. Looking forward to working with you, and because I know they're all here, and their advisors as we move forward. So welcome to our new Planetary Health Graduate Scholars. And another announcement, as I noted earlier, that these scholars have been possible because of a gift from Sarah and Dave Epstein, the UW alumni and members of the Global Health Institute Board of Visitors. Dave earned his undergrad and master's from UW-Madison, and he is an advisor, investor, management consultant at Epstein's Advisors. Sarah earned her undergraduate degree here, and her master's, she went all the way to the East Coast, Boston University. She works in a test kitchen. The test kitchen of Sunset Magazine, is a freelance recipe tester, developer, and writer, and unbelievable chef, because I've experienced that. The Epsteins are committed to planetary health and its promise for a better future for all. So I am so honored to announce that Dave and Sarah have made another generous contribution to the Global Health Institute and the Nelson Institute, because not only did they start this first ever graduate scholars program in planetary health, but they are now gifting for a planetary health postdoctoral fellow, a 2-year research position focused at the intersection of energy, climate change, and human health. And applications are now open because we want this postdoc to start this summer, ideally. So please give a round of applause for Dave and Sarah, and thanking them for their incredible generosity for this. So I'd like to thank all of you for attending tonight's webinar, and I hope we'll see you again in the fall. This is our last Global Health Tuesday webinar. We're going to start up again in the fall. So please feel free to reach out to us if you'd like to learn more and get involved. and also feel free to contribute to global health. And I want to remind you, as Anne put in the chat, a reminder that all of these videos are available on the Global Health Institute YouTube channel. So you can see all of these videos on our website. And for the current scholars that are, our current cohort of scholars and the Epsteins and staff, we're going to take a 30-minute break for dinner, so you can grab some dinner and come back for a wild debriefing and party. This isn't for everyone, just for the scholars and faculty and staff with the Epsteins. We're going to have a virtual party in 30 minutes, beginning at 7 p.m. Madison time. Valerie, Monet, anyone, did I, anything that I'm missing, or are we good to sign off and close this part of the session and come back in 30 minutes for our follow-up party? Did I miss anything? If I don't, I'll say silence is, okay, I see. Think we're good. Thanks. So great job to everybody. Congratulations. Really exciting projects. And this is exactly what we want to see, innovation from you who are younger and smarter than your advisors, and to see this come together, it's really exciting. Thank you, and see you in 30 minutes for the party. Anne and Valerie. Hey, Valerie.
Yes.
So only 2 minutes over.
I know. Good job. You did good.
Thank you.
Good.
So,
all right.
Well, who's going to be at the party besides the scholars, the Epsteins, me, you, Kaylin? Well, the advisors aren't, the mentors aren't going to be at the party, are they?
They're invited. Yeah.
Invited. Okay. Anyway, I see. Let's see who's on here. 5 people are on. Oh, good. So we have a few people. Oh, there's Laurie. Okay. So, all right. So I will see you at the party. And I saw the prompt questions for the scholars. And great job. I wonder what happened with the Daniel's talk, but anyway, I think it was, other than that little glitch, it was really nice.
Yep, definitely. Okay, see you soon.
Okay, bye.
Okay, bye.